Now for this video, you can see we moved some organs out of the way. It's representing the lumbar plexus. So we're on the anterior side. So remember the muscle group we talked about. So you can see here's the psoas major. So that's that vertical loin that goes up and down. The quadratus lumborum will be right there, okay? And the iliacus muscle, it will be right here. Okay, so psoas major, iliacus muscle, quadratus lumborum, okay? So now, let's talk about the different orientation points. This is the superior part, that's the inferior part, that's the lateral part, and that's the medial part. And then anterior to the front. Because remember, we have different nerves arising from the different orientation points of the lumbar plexus. So right here, we will have all these fibers that will distract you. But remember, focus on the fibers that matter. So right here, on the superior side or direction of the psoas major, we will have these two nerves. You guys see those? So we have the iliohypogastric nerve and the ilioinguinal nerve. Sometimes they'll originate from one nerve and split into two, but this time they're split into two. Okay? And how can I tell which one's which? Remember, it's the hypogastric that's always superior to the ilioinguinal. So you can see that right there. Hypogastric, gastric pertaining to the gastric region, inguinal pertaining to the inguinal region. So which one is much higher? Your gastric region or your inguinal region? So it makes sense to name him as such. Iliohypogastric nerve, ilioinguinal nerve. Now let's move to the anterior aspect, and you can see this nerve right here. Again, there's going to be distractors in there, but remember, it's always going to be on the anterior. So what's going to be that anterior nerve? That will be the genitofemoral nerve. You guys see that? Okay, and there will be distractors. As long as your IA is tagging something on the anterior side, you know you're looking at the genitofemoral nerve. Now, I'm going to move the camera, okay? You will see the inferior portion of the psoas major, and remember, here's the medial part. The lateral part. You see that nerve right there, that big nerve, okay? And that big nerve is the femoral nerve. And remember, the femoral nerve is the biggest nerve in the lumbar plexus only, not in the whole body, okay? And then the medial side of the psoas major, the medial side on the inferior portion of the psoas major, we will have this nerve right here, and that will be the obturator nerve. So obturator nerve, femoral nerve. Then look, there's a nerve next to the femoral nerve, lateral to it by the iliacus muscle. So therefore, that will be the lateral femoral cutaneous nerve. So let's do a little summary. Iliohypogastric, ilioinguinal nerves, genitofemoral nerve, lateral femoral cutaneous nerve, femoral nerve, and obturator nerve. So remember, there will be distractors, but focus on what is located in the appropriate locations.